Good morning, everybody. Apologies that I couldn't do Facebook Live this week. To my regular viewers, Facebook kept shutting down, just kept closing down altogether on me. So I've decided to record this and post it as soon as I can get it uploaded. So this week's blog, it's all about premenstrual dysphoric disorder, which is a condition that affects women. Very similar, as I was saying, to PMS, which is premenstrual syndrome, occurring usually in the last 2 weeks of your cycle. Now, in saying that, PMS and, this disorder are very similar, but with premenstrual dysphoric disorder, the symptoms are much more severe. They are much more chronic, and they are life-altering and disruptive, and life can cease to exist on a daily basis. Basic life can cease to exist for somebody at the severe end of the scale with this condition. And the reason I'm highlighting it is because it can affect your mental health really badly. Some of the symptoms are, in fact, mental health symptoms, and we need to be more aware that this can happen. It is less common than PMS, but it is still there, and it has other conditions that it can lead out to, such as postnatal depression if you go on to have a baby, and your life in general can be made very miserable. And even if you only have the milder form of this condition, you could have it and put it down to PMS and not realize that you need extra help. So that is why I'm highlighting it, because it is, I would say, treatable. It's manageable is more like it. So think about, if you think you have some of the symptoms that I've highlighted, if you think you have a lot of the symptoms that I've highlighted, if you think it's more than PMS, the sooner you go in and start treatment with your doctor and with a therapist, and then it's, there are other things you can do, self-help. There's a lot of self-help with this. It's a kind of a team effort is what we need to do with this condition, to manage it and make your life much more livable and much more functioning again, instead of being confined to your home or your bed because of this condition. So let's talk about it. As I said, much more severe. It's a very chronic condition, more severe than PMS, and debilitating, absolutely debilitating. So what are we talking about? Apart from the physical symptoms, which I've listed out, there's quite a lengthy list of symptoms. You don't have to have all of those symptoms again to be diagnosed with this condition, but you're looking at a combination of mental health condition as well as the physical symptoms to combine to get a diagnosis. You can get an official diagnosis and start treatment. So the mental health part of it would be depression, anxiety, panic attacks, paranoia, irritability to the extent of outbursts of anger and maybe getting physically angry, lashing out at people. So, again, all symptoms that can be treated, all symptoms that can be managed, as well as the usual plus more physical symptoms. So all the symptoms I've listed, they're on the blog. It's quite lengthy. I'm not going to spend my time, listing them all out and going through them. You can read them, and see how many boxes you tick if you feel that or if you are a parent of a young lady, or a a brother, or a husband, or a partner to someone, and you think their PMS is very severe, then check out the symptoms. Education should be both. If you're in a relationship with somebody, then male and female should both know the symptoms, and should know the symptoms of PMS even, so that you can help and you can be more understanding. Now, in terms of the cause, as always, as I've explained to you before, causes, we say cause unknown because we cannot pin it down to a particular thing. In this case, the cause, they reckon that the cause is because the women involved are more sensitive to the hormonal fluctuations throughout the cycle. In particular, serotonin and melatonin, they fluctuate during a woman's cycle. And with this particular condition, these fluctuations can be felt more, or they can be more severe in somebody with this condition. So this is what we think is causing it. There can also be a family history. So this is where we're talking about somebody perhaps with a family history of, mum had or grandmother had postnatal depression, had depression, had some sort of mood disorder, or even other male members of the family. If you've got a strong history of mood disorders and depression, then this puts you in an increased risk of having this condition. So you've got to look at, family history and what has gone on. If you can trace that back, it can be very helpful. The other thing about postnatal depression is it's kind of cyclical. Mum could have had it or grandmother could have had it, and then that predisposes you to this condition. And then if you have this condition, you're at a higher risk then again of developing postnatal depression. Now, always remember, with postnatal depression, men can get it too, and you don't have to have biologically had a child. You could have adopted a child. It isn't, postnatal depression isn't dependent on some sort of chemical change that occurs when you give birth. It is, it doesn't require that for you to be diagnosed with it or for you to have it. So that is why we know that it can affect men as well as women. And, it can affect somebody who has adopted a baby, maybe, men or women who have adopted a child in the same way as if somebody had given birth to that child. So that's one thing, you need to be aware of. Now, in terms of diagnosis, again, there is a specific diagnosis and how they do it. And if your GP isn't aware of this condition, because an awful lot of GPs may not be aware of this condition, perhaps bringing along, the Diagnostic and Statistical Manual number 5 with you and showing them, look, these are from this, you don't have to bring the whole manual, but just print out that page and say, these are the conditions, these are recognised mental health conditions. I have this, I need to be referred on to a specialist or somebody who knows about this condition, and get diagnosis. Because as I said, you need treatment. You need to get it as early as possible. You want to get on with your life. You do not want to spend years suffering from this condition and not get the help that you need. In terms of treatment, it is multifaceted. It is self-help as well as working with your GP or working with your gynecologist, working with the specialist that you've been referred to, working with a psychologist. It is as I said, multifaceted. So how we target it would be if you need an antidepressant, if you need anti-anxiety medication. So we're going to be treating the mental health symptoms. We're going to be treating the physical symptoms. Birth control birth control pills also help. As you know, with PMS, birth control pills can help that. Unlike PMS though, sometimes with PMS, when you've had a baby, the symptoms can ease, or severe period pain can ease after you've had a baby. Unlike that, with this condition, this condition doesn't ease after you've had a child. And it goes right the way through until after menopause. That is the other thing you have to realise with it. PMS symptoms can ease for a time, and then they can get worse during the menopause again. But you've got to understand that it's continuous. It doesn't get any better if left untreated, and will return after you've had a child, or will continue while you're pregnant. So you have got to be aware of that. So yes, the birth control pill will help. Antidepressants, anti-anxiety medications will help. As will, of course, pain relief. You'll have to talk to your doctor about that. What type of pain relief? Sometimes you need a higher dosage of pain relief than over-the-counter medication. The other thing then, of course, you have to have therapy. Talking therapies, CBT in particular, is very important with this condition. We're treating the mental health. You have, the imbalances are there. You need to treat the depression. You need to treat the anxiety. You need to treat panic attacks. You need to treat the paranoia. You need to treat the anger, why you're getting angry. You need to treat all that. You're going to need the CBT to help you cope with some of the symptoms. So they're the two, working with your GP, working with your consultant, and working with the psychologist. And then there's the self-help. Stress management will be highly important. Reducing your stress levels, extremely important with this condition. Relaxation techniques, meditation, yoga, anything at all that can reduce your stress levels. Even changing your job. Sometimes you might have to change your jobs. You change your job if you haven't already not been able to go to school and college and work is going to be affected. As I said, completely debilitating to your normal everyday life, and functioning is going to be completely debilitated. Perhaps everything has to stop for those 2 weeks. So that's very difficult to have a job, very difficult to maintain going to school or going to college or continuing in a workplace. So, you've got to look at, perhaps it's time, if that has been the case, perhaps it's time then to look at, well, what kind of job will I do? And look for jobs that are less stressful. That you can do, but at the very least you need to be doing stress reduction. I have a blog up there with a whole list of ways and methods that you can actually help yourself. I also have a podcast excuse me, I have a podcast there which shows you how to do meditation, both mindfulness and 7-11 breathing technique, and the 3-minute breather are all up there on my podcast. If you want to check those out. So anything at all that you can do to reduce your stress level is going to be highly important. Diet and exercise, again, change of lifestyle. This condition has changed your lifestyle. Well, now you need to take it by the horns and go, okay, I'm going to investigate is there anything in my diet that is triggering some of my symptoms? Is there anything I can do in terms of exercise that can help me? You can combine the exercise with relaxation, but also maybe combine, walking is brilliant, swimming, anything like that. It's going to get your serotonin levels up and get it at the kind of more even keel. So look at exercises that are going to really boost your serotonin levels. You also, supplements. Any woman will tell you supplements are great for PMS. We're talking about evening primrose oil here. There is good studies there. You want at least 1,000 megs. You can get them. I'm not going to name the supermarkets. Okay, but you can get them in the supermarkets. But 1,000 megs. You want 1,000 megs. If you can get starflower oil, even better. It has been proven to be even better than even primrose oil. I've listed a few other supplements that they've done studies on and that have helped this condition. The other one is Agnus castus. Some of you may not have heard of Agnus castus. It is you can only get it in the health food store. It is a tincture. It is vile tasting. You take it once a day. Take about 30 drops once a day, and have something, to drink, real quick juice or something to drink. Rinse out your mouth afterwards. But it is extremely excellent for PMS. Extremely excellent for PMS symptoms. So it would help with some of the symptoms that are here. The other ones is calcium with vitamin D, vitamin B6, or, if you can get the B complex, either you get enough in that, and vitamin E. All studies are showing that all these supplements are proving to be excellent with the other things I've already listed. So, it's a combination of treatment. So these supplements, plus your diet, plus your exercise, plus your stress reduction, plus your therapy, and plus working with, an anti-anxiety tablet or that. The only thing I'd say to you about supplements is if you're taking any sort of medication, prescribed medication, please be careful, because there can be an interaction between them. So do get advice on that. Do get medical advice on that. I am not a medical doctor. And alternative therapies. That would be the last thing I'd say to you. Alternative therapies, reflexology they recommend, and acupuncture they would also recommend. So, look at those alternative therapies as well. A lot of things you can do there that are self-help. The most important thing, though, is if you recognise that you have these symptoms, straight away to the GP. Get help. Get referrals for a consultant. Get a referral for, your therapist for therapy. That is the first thing you need to do. Don't let this go on for too long. Early treatment, as always with any treatment with regards to mental health, the earlier you get in, the quicker it is to help, the quicker it is at bringing you back to centre and getting on with your life. So I will leave it there this morning, and thank you all for listening. And again, I apologise for not being able to do this live. You can check out this week's blog, which is at www.deborahbyrnepsychologyservices.com, and I will see you all next week. Hopefully the weather will be better. And Monday's blog is on dementia, so people might want to check that one out. And thank you for listening.